I'd like to welcome our first speaker, which is Professor Charles Parry from the South African Medical Research Council.
Thanks, everybody. Appreciate the opportunity to speak today. As you heard, I'm going to be speaking about unnatural deaths, alcohol bans, and curfews in South Africa, evidence from a quasi-natural experiment during COVID-19. I've listed the other people who worked with me on this paper. That's the DOI is listed below, and I can send it to people if they're interested. So the purpose of our study was to evaluate the impact of restrictions on the sale of alcohol and look at the duration of curfew on numbers of unnatural deaths in South Africa, and also to offer an academic analysis of the matter in the face of widespread media coverage of research funded by the alcohol industry, which sought to show that it was really the curfews and not the limitations on alcohol sales that was causing the drop in deaths and trauma. In terms of the data, we looked at death data collected by the South African Medical Research Council, my organization, and the University of Cape Town, a collaboration between the two organizations, which has been collecting data on unnatural deaths from January 2020 up until mid-April this year. But before I go on to that, I just wanted to have one slide giving you a little bit of background about the drinking situation in South Africa. This is from the WHO's Global Status Report on Alcohol and Health 2018, which showed that only 31% of adults, that's persons over 18, consume alcohol or current drinkers. But where we stand out is we're actually number 6 in the world in terms of the amount of absolute alcohol consumed per drinker per day at 64.6 grams, which is 5 to 6 standard drinks in South Africa. So a lot of alcohol is being consumed by drinkers. And this is confirmed by the data on binge drinking, where we are 9 percentage points above the global average at almost 6 out of every 10 drinkers engaging in binge drinking at least once in the past 30 days. Getting back to our study here, the slide below shows the weekly numbers of unnatural deaths in South Africa from week 1, which is basically early 2020, to week 15. And what you'll see there is the predicted number of weekly deaths. And then the forecast is the darker blue dotted line, the forecasted expected number of unnatural deaths. And this is derived using a regression model based on the Department of Home Affairs' data from 2014 to 2019. So we have 6 years of earlier data to help develop a prediction model which has got a 95% confidence interval around it. But let's overlay that now with the information on restrictions on alcohol. And what we've done is the green areas are where there is no restrictions on alcohol or a very limited a curfew. And then the redder it gets, from kind of yellow to dark red, is the strength of the restriction. So you'll see the second period is the level 5 lockdown from sort of late March last year to the end of April, which was a complete full restriction on alcohol sales and basically a shelter-at-home situation where you could only go out to buy food or go to a hospital, or if you were part of sort of certain essential jobs. And that was followed by level 3, which was a continued full restriction on alcohol, but the curfew was an 8 to 9 hour curfew. So the stay-at-home order was lifted. Then there was a break on the 1st of June, which is level 4, which was partial restrictions on alcohol. It was curbed for on consumption and more limited for off consumption during the week, and there was no curfew and so on. So you can see we had, in this particular phase, we had sort of 3 periods of a full lockdown. In fact, we had a 4th period, which goes beyond the graph that I'm showing. So 4 periods of a total of 164 days, in fact, where we've had no alcohol to be sold at all. Obviously, you're allowed to consume it in your own home or make it at your own home. So then we fitted a model to the excess unnatural deaths. So you'll see on the previous graph, if I go back to it, you'll see at some periods, you'll see there's a drop in unnatural deaths, and in a few periods, there's an excess of unnatural deaths. So it's the movement from the dark line, the black line, to the darker dotted blue line gives you excess unnatural deaths or a reduction in unnatural deaths. So the excess could be negative or positive. So we had two covariates, which is the nature of alcohol restrictions, full, partial, or none, and the duration of the curfew. Was it no curfew, 4 to 7 hours, 8 to 9 hours, or level 5, which was stay-at-home order? And you'll see the graph on the right, the observed excess deaths, the dark blue line jumping up and down, and the red line is the fitted excess deaths using the model. And the model explained 75% of the variation. So this is the main finding here. Let me just explain the plot. You'll see on the y-axis, the weekly excess deaths from unnatural causes. These are unnatural deaths that's due to suicides, homicides, motor vehicle collisions, and so on, ranging from 200 to minus 600, which means there's a drop in unnatural deaths. And on the that's the y-axis. The x-axis is the curfews, and then displayed in the graph is where there's no restriction, which is the blue circle, and the partial restriction, which is the red circle, and the green circle, which is the full restriction. And you'll see, for example, that full restrictions on alcohol resulted in significant reductions in unnatural deaths, increasing with the duration of the curfew, and that partial restrictions had less significant effects on unnatural deaths. And you'll also notice that there was not much difference between a 4 to 7 hour curfew and an 8 to 9 hour curfew when we had the full restrictions. So the liquor industry was saying that basically it was all about the curfew and had nothing to do with the liquor sales, which I think this graph proves wrong. 2 slides for conclusions. While the bans on alcohol are particularly blunt instruments, they affected people whether they were heavy drinkers or moderate drinkers. As I've said, the argument that it's the curfew or restrictions on mobility rather than the bans on sale that averts unnatural deaths is refuted in this analysis. And in fact, we have a full a supplementary appendix which looks at various restrictions on mobility as well to counter that argument. And in terms of numbers, the full restriction on the sales of alcohol reduced unnatural deaths by between 42 deaths per day with the 4 to 7 hour curfew, and we had 74 deaths per day reduced unnatural deaths under the full lockdown. And probably the upper limit of 74 is in fact the upper end of the range, because the ban on alcohol was introduced very suddenly and there was no time for a black market to get going. But the main conclusion is that partial bans on the sale of alcohol were of questionable efficacy in reducing unnatural deaths. And these were banning people from drinking on consumption establishments or substantial restrictions on the hours and days of sale for off-consumption sales of alcohol. There was also clear evidence of the link between alcohol and unnatural deaths. Obviously, I've been talking about that, but it does suggest that this is obviously not a strategy, a policy we can continue in the long term, and that we really need to look at other restrictions on advertising, for example, banning advertising except at points of sale, limiting the quantities people can buy, because sometimes people are buying it at a registered outlet and then selling huge quantities through unregulated outlets. Also, the volumes we found through our research, the International Alcohol Control Study, that when people buying it from larger containers, there's much more likely to be heavy drinking. So we're also proposing that, and minimum unit pricing. And we just had a paper come out of that with colleagues at Sheffield University last week. In terms of limitations, clearly we only looked at unnatural deaths, but another study that I was part of that came out in the South African Medical Journal this year, looking at one hospital and the effects on trauma, found very similar findings, that it was the full banning of alcohol sales that had the impact on trauma, and the partial bans did not have a statistically significant impact. And clearly, while the quantum of unnatural deaths averted might not materially reduce the burden faced by COVID surges, certainly unnatural deaths is the extreme end of the trauma spectrum, and so certainly you can expect a decrease on the burden of hospitals from this study. We didn't look at the knock-on effects, such as the economic effects in terms of losses of excise taxes. The industry claimed huge drops in revenue, but in fact, the data from their reports have been showing from, for example, SAB and Heineken and Distell, found that through certain quarters or 6 monthly periods, they actually saw an increase in sales. We didn't look at, obviously, knock-on effects in illicit trading, and that's something to look out for. And my last slide, just leave it up quickly for a minute. We learned some various lessons, and just to run through them without going into details, it exposed the culture of heavy drinking. Particularly, it drew attention to the burden of heavy alcohol use on trauma in South Africa. It was interesting, the president said that alcohol is not an essential product, which was good to hear. It showed that change is possible, although obviously this is not the kind of thing we're recommending long term. It raised questions about the society we want to live in, exposed weaknesses in our alcohol regulatory environment. It showed lengths the industry would go to get their business back, but that's a story for another day. And clearly it highlighted gaps that we need to address. And we're now looking into better measurement of alcohol-related trauma. Thank you.
Thank you so much, Charles. I'll start us off, I guess, a bit of a question about the curfews and the argument from the industry. Was the difference in the curfew, I mean, I'm wondering if the curfew covered the time while people were sleeping.
Yes, the curfews generally, if it would go from sort of 8 p.m. at the most, 8 p.m. to sort of 5 a.m. in the morning. So, but obviously, so it was cutting out times when people, the early evening and also the very early morning, when you often get a lot of alcohol-related trauma and injury.
Mm-hmm. And then the second question, I'm wondering about, so policy recommendations about the partial restrictions, whether your study differentiated between, I think I understood there were partial restrictions on the on-premise. Was there partial restrictions on off-premise as well?
Yes. For a long time, we often only were able to sell. In fact, currently, you can only buy alcohol Mondays to Thursdays from, I think it's 9 to 6 p.m. In fact, when we came out of the hardest lockdown, we did find if I go back, I don't want to go back to the graph now, but it did find a slight effect for the restrictions on off-consumption sales. I think it was 11% drop in the unnatural deaths when we had the first lifted the complete sales ban. So it would indicate that you might get some effect from restricting off-consumption sales to say 3 to 4 days per week and limiting the hours, say 9 or 10 o'clock in the morning till 6 p.m. Yeah.
Okay. Just looking through hands, and of course people can absorb and come back to questions at any point, and we'll have time at the end. So there were restrictions on days of the week. Were there any restrictions on quantity?
No, they never got around to that. We talked about that. We tried to get the government to say, look, now's the time to bring in other interventions like controls on marketing. You shouldn't be marketing alcohol during a pandemic, or controls on container sizes, saying let's try this and an experiment and say you can't buy beer bigger than 750 milliliters and things like that. But the government really only seemed to have 2 or 3 tools they were willing to try, which was off-consumption restrictions, on-consumption restrictions, or complete bans. So it was unfortunate. Yeah.
Okay. Thank you, Charles.